Hello and welcome back to Bedside Murmurs, a podcast where we chat with doctors about their careers, pathways of medicine, clinical tips, and much more. If you have any questions or have any ideas for guests you would like to see on the show, shoot us an email at podcast@medsoc.org.au. That's podcast@medsoc.org.au. I'm Sean.
And I'm Emily, and we will be your hosts. Today, we have the pleasure of chatting with Daniel Selvadurai, who is a final year medical student at UNSW. Daniel has completed work on improving outcomes for gout sufferers, which is part of the Gout APP national study funded by the National Health and Medical Research Council. He has presented his work nationally and internationally and has won awards, including the Best Clinical Poster Award at the Australian Rheumatology Association Annual Scientific Meeting. We are very excited to chat with Daniel today about his experiences during medical school, his tips for excelling academically, and reflections on medicine. So welcome, Daniel, to Bedside Murmurs. It's a pleasure to have you on today.
Thank you so much. It's a real privilege to be on. Thank you.
So first up, why did you want to become a doctor and what was your journey into medicine?
I think it's quite a universal sentiment that we want to help people, and I absolutely do want to help people and still do, and I'm sure both of you do. But in high school, I was a bit pragmatic, and I thought, you can help people in a lot of different professions. You can help their health. You can help them live their best lives in lots of different pathways. So it was through work experience and personal experience that I saw how the doctor is able to help people in the specific context in which they do so. So when a person comes to a doctor, they're possibly having one of the worst days of their life, worst weeks, months. And it's, a real privilege that we are able to support these people during such a difficult time. And I think doing this work is incredibly gratifying. But also the way in which we help people involves a discussion with the patient, taking a good history, understanding the patient's perspective, and then integrating that all with the years of learning we do. And then it's quite intellectually stimulating to come up with a differential diagnosis and management plan, which of course occurs in a multidisciplinary team. So your job also involves working with lots of different health professionals in a really big team and ultimately putting the patient at the center of it all. So I think medicine was appealing because it's a unique way to help people that's very fulfilling. It involves teamwork and it's quite intellectually stimulating in that we'll be lifelong learners and continue to learn for the rest of our lives. How I got into medicine, well, UNSW is an undergraduate program, so I'm not sure I'm going to win any awards for, original stories of going into medicine. Actually, on my current rotation, one of the registrars was in a band, and we're not just talking garage band, but like touring Australia and the world. So that's an interesting story.
That's a great story.
It is. It is. He showed me the Triple J write-up of his band, and I guess what I'm saying, there's a lot of interesting journeys into medicine, but I'm not sure if I have anything interesting for you today, unfortunately.
Was there a specific experience that you could think of that kind of defined your trajectory, especially in high school? Because I think one of the criticisms that people have for undergraduate unis is, you should give people a little bit more time to kind of explore their lives before locking down into medicine. Was there a certain point during your journey where you thought medicine is definitely something I want to do within the high school period?
So even going back way before high school, I think I always knew I liked relating with people. I liked talking with people and understanding different perspectives. So I knew I wanted to do something that was quite human-centric rather than working with numbers or statistics or in an office. And then gradually, I guess, just my interactions I had with my own doctors and also work experience where I could actually see what happens. So when I started medicine as a teenager, I didn't have, of course, the biggest wealth of life experience. But 6 years of learning on placement, learning from patients and doctors, it just sort of vindicated what I thought all along. Yeah. So I came in quite green, but I've been really lucky in my experiences have sort of validated my choice.
And what do you think are some things that you have learnt during your time at medical school?
So I think broadly we can sort of think about preclinical years and clinical years. Yeah. Preclinical years, I know to get into medicine, everyone's already quite organized, but I think, studying medicine takes it to a new level because you have a lot of content you have to tackle with. And it's up to you to prioritize your own learning. You can't know all the information equally well. Yep. It's about, timetabling your own learning and deciding where to spend your time, it's very easy to fall behind if you don't, you're not motivated and focused. And I think even though that was always me, even through high school, I think in university it's even more important to be really focused. In terms of clinical years, it's all about being a self-directed learner. You've both done the sort of portfolio in phase one.
Yes.
So I'm sure you've heard about self-directed learning.
Yes.
What's your understanding of self-directed learning?
That's a really good question, actually. I think, my experience of self-directed learning is it's the opportunity to go and try to grab at the things that you find will be most useful for yourself.
Yeah,
so
absolutely.
It's a really great thing that UNSW does, where it puts self-directed learning into the focus and it allows you to, I guess, take ownership of the things that you want to learn. I have heard counter arguments where it's does that just mean that the university takes a sidestep or step back in terms of that? But I don't think that's true at all.
I don't think so either. I mean, the university definitely promotes self-directed learning, but it's in a framework of there are opportunities. These are some opportunities that you can take. And if you want to take them, we're going to support you to do that.
So on the commute over to hospital each morning, I think it's really important to just ask yourself, what do you want to learn on that particular day? The worst thing you can do is just be an observer or succumb to presenteeism, where you're just there for the sake of being there. And doctors want to help you. They want to teach. They're really lovely, but patient care takes priority. So if you're not asking yourself, how am I going to learn today? It's very easy to be lost in the crowd. So I might go, today, every patient on this ward round, I want to open EMR, look at their medication chart, ask myself, what are these medications? Do I know how they work? And do I know why the patient's on them? And just every day having sort of a little sort of task for yourself to achieve. Maybe today I finally going to get a cannula and take some bloods. Or maybe it might be, I just need to get this sort of clinical assessment signed off. So I think the clinical years have taught me is that you really need to take responsibility for your own learning and make sure that, every minute counts, because there's just so much you could be doing. It's such a privilege to be able to be a full-time student, and you should make the most of it.
I think I do want to add, because I've heard a little bit of complaints of self-directed learning, because sometimes in third year, especially for us, it feels as though we're not quite sure what we're allowed to do. And what that extends to is, since we're not sure and we're kind of scared, we're green in the hospital, we don't know what parts of the hospital we're allowed to be in and what we can actually do, it becomes quite a scary experience, and people just kind of really... self-directed learning almost gives you the opportunity to sink back and not do as much, because it allows you that opportunity, because you take control of your own learning. So if you don't really want to do that much, you can kind of just not do that much.
Sure. I think the counter argument that is... we're all adult learners here in this medical program. We're dedicating... actually our entire lives to learning, because that's what doctors need to do to, look after their patients best. And, if you have this wonderful opportunity, the whole hospital is like your oyster, and you're choosing, not to put your hand up and put yourself out there, I think ultimately that's just the individuals who needs to take accountability. Because I know it obviously can be quite, stressful and unnerving to not know your place in the hospital. But I think one of the doctors at the time just said to us, actually it was Dr. Melvin Chin, a wonderful medical oncologist. He's very involved in medical education. He said to us, being a medical student is a pretty sweet gig, because there's a universal understanding that you're just there to learn. Patients, they're really lovely. They understand that they will tell you their stories. Doctors will also understand that you're here to learn, and you can just sort of, to use his own words, be this sort of flexible, sort of dynamic person that can move between clinics, move between wards, and you can just show up where you want to with your ID badge. Of course, you ask consent. And Sean, to answer your question, what you can do as a medical student, well, it's not being the primary surgeon on that bowel resection, but everything else, as long as you ask and polite about it and show your student badge, you can do so much really interesting things. You could just show up to the operating theatre, sign in at the front, check there's no other student there, go in, introduce yourself to the circulating nurse, say you're a medical student, and they'll let you watch. They might even let you scrub in. You can do anything. And they understand that you're just a student. And if you never see them again, they will understand, So I do remember being in third year quite anxious about where my place in hospital is. Am I being a nuisance? Am I getting in people's way? But you eventually just, understand that you are, dedicating your year. You are paying money that the taxpayer is, graciously funding it as well. But you're there to learn, and you should make the most of every opportunity.
That's so encouraging.
Yeah.
I now feel inspired to keep going back to hospital learning
go to
more.
OR. Yeah. I've been trying to convince people to come OR more often because I'm usually like 24/7 at the OR.
Yeah.
Yes, I'm a little bit more hesitant to go to the operating theatre, but I do love clinics. So,
Well, another really interesting thing to do is just go to any random medical ward, find the intern, find the resident, and say, hey, is there anyone with interesting signs? And they would know. So even if you don't take the full history or do the full workup, you'd probably bump into lots of murmurs and peripheral edemas and interesting cranial nerve signs. And, after that, you can just leave and go to another ward, and no one's, you're right, no one is monitoring you. And you're right, some people might choose to do nothing, but that means for the interested, keen students, they can do as much as they want. And I think, clinical years is a truly valuable time if you make the most of it.
So what was it like having medical school during COVID though? Because I'm assuming that those experiences might have been a bit more limited and learning would have been much less hands-on.
Yeah, and when you ask me that question, it just reminds me how old I'm getting. Because you both would have been in high school during 2020 and 2021. Yeah. Wow, okay.
Yeah, my COVID years were high school years.
Yeah,
so
wow.
HSC was completely in COVID.
Yeah, so in 2020, this was my preclinical year. Everything went online. And so we're meant to be in hospital for 2 hours a fortnight. So we lost that completely in second year. And obviously, I'm speaking from a place of privilege because, lots of people had family interstate or abroad or financial issues. And, the mental tax of COVID can't be understated. But I guess for this podcast, purely from the medical education point of view, I thought medical faculty did an amazing job. And I'd actually say the standard of my preclinical years was greatly enhanced because, suddenly lectures weren't 1 hour in this massive lecture hall where you couldn't interact. Suddenly the lecturers were putting polls in their Zoom lectures. There was chances to ask questions during the lecture, and the lectures often turned into seminars that prioritized understanding rather than just didactic delivery of content. And then when examination time came around, there was an emphasis on understanding rather than memorization because they were open book exams. And the way we prepared for those exams meant that we were now understanding content. And even now, looking back 4 years later, 4 years later, is that right? 1, 2,
it would be,
wow, 4 years later, the courses I did in preclinical years, I retained a lot more information from those than the ones I did in person in first year. But then moving on to clinical years, so the Delta wave in 2021. Again,
that's such a throwback.
When things, again, I'm talking from a place of privilege. I was at Prince of Wales Hospital, but also my order of clinical terms meant I only actually missed a week on the wards. But some of our friends at like St. Vincent's or Liverpool were locked out for months. So I know their learning did suffer quite a lot. But I guess personally, I was just lucky in that I could continue to learn. And so COVID, it did set us back a bit, but ultimately there were opportunities to catch up. So in fourth year, we might talk about that a little later, which is normally a full-time research year. Medical faculty arranged for us to come in once a week to sort of keep our clinical skills up. So looking back, I think that COVID actually enhanced my theoretical understanding of knowledge, and the clinical side of things we just caught up because you got to do what you got to do in the end.
Yeah, that's a really interesting idea.
That's interesting.
Yeah. I really like how you broke down what the differences between COVID teaching and what teaching was beforehand. And I really like how you explained the fact that it's online actually brought students who might be further back in the seminar room much closer to the educator. And there's been huge discussions, I think, about whether Zoom is enough of an alternative or good enough of an alternative compared to in-person lectures. I know there's a huge push to go back into in-person lectures. What would your experience kind of say about whether in-person lectures are better or online lectures, or do you think there's a healthy mix to be had?
So firstly, I'd preface this by saying this is a personal opinion. We all learn differently. But when we talk about in-person teaching, there needs to be a separation between, I think, tutorials versus lectures, because lectures by nature are didactic, but tutorials are interactive. I think tutorials in person are far more effective than online. So like when you're meant to have small group discussions, when you're meant to converse with tutors, I thought the Zooms weren't as effective because you couldn't interact with people and work in teams as effectively. Because in your clinical years, you'll have lots of clinical tutorials with experienced clinicians, and I just learn so much better in person. But if we just say have an hour of content that needs to be imparted from the expert,
inherent
information. If there just needs to be delivery of information, transfer, I think there still is a role for Zoom or at least hybrid formats. But ultimately, I trust the faculty always does the best thing by students. And I think we've seen that the last few years that everyone's just been really grateful for how great they've been. So I think maybe in the future that there will still be a role for, or maybe even pre-recorded pre-work, because I think that's what we had in clinical years. Like don't bother showing up to this tutorial unless you've watched or done this module. And I think that was also an effective way to teach.
Yeah, that's really interesting. It brings back to the point of like, you should only go to the lecture if you already know the didactic information, and then you're there to interact and understand.
Yeah, so I mean, like only go to the tutorial if you've done the lecture.
Yeah,
you can show up to the lecture not knowing anything.
I guess part of that is also being self-directed in your learning, taking that opportunity to actually think, I'm going to learn this content before I come to class or before I come to clinic. So when I'm actually there and I have access to the academics who are experts in their field or people on the wards who know what they're doing, I can actually learn things and spring off and not just go from nothing.
Great, yeah, absolutely. Because on my first day of obstetrics, I didn't know which clinic I was going to be allocated to because the timetable comes out. So I was into this antenatal clinic, and well, I couldn't have done pre-reading because I didn't know I was going to be there. And I just felt like I wasn't really absorbing a lot of information or understanding because I hadn't done the very basics. Look, no one's expecting medical students to be, experts, but just know the absolute bare minimum. So like subsequent clinics, both in obstetrics and other specialties, you just get so much more if you just have a framework in which you can sort of distribute the knowledge you learn.
Yeah, and almost being curious about.
Yeah, absolutely.
Based on your experiences as a final year medical student now and looking back at all the things that you've done with clinics and with ward opportunities, what do you think are some opportunities and experiences that were really worthwhile that we should really as a medical student be thinking, yes, that's helpful for my learning and that's actually going to help me in the long run?
I think looking at my experiences, but also my friends and colleagues, I don't think there's a such thing as a bad experience for learning in medicine. If you put your hand up to do something, I don't think you're going to walk away and go, wow, I wish I hadn't done that. You'll take something away from it. It might not be what you envisaged initially, but it'll be something. But personally, I guess we already talked about, going to different wards and examining as many patients as possible. But talking outside of medicine, we're not doctors yet, so we can't give medical advice. That's sort of like a legal obligation. But also in the community, you still do have a role for like advocacy and education. So things like, visiting your old primary school, just to talk about the role of doctors in the community. We did Teddy Bear Hospital as well, which is a really great initiative.
That's good fun.
Yeah, going to the doctor can be pretty scary for some kids, and it just, as a medical student, you know more than you think you do at times. Also, just saying yes to every opportunity. So I found myself for the last few years being an exam assistant, so like a bulldog for the RACP clinical exams. So that's where you take the trainee doctor who's like very experienced, they've worked very hard, and you go with them from station to station at their big sort of clinical exam. And you learn so much by doing that. And then finally, I guess just getting involved in medical education in any capacity. I think both of you are already doing that by running this amazing podcast. But, like putting your hand up to run tutorials for younger years. And even, I remember in third year, I'd think, I'm in third year, how can I help these first and second years? But, even though you as third years might feel unsure of your role in the hospital, I guarantee the first and second years feel even less assured. So you can definitely, offer to run bedside tutorials or run mini, teaching sessions on key concepts. And I think there's a massive pay it forward culture in medicine, which is amazing. And getting involved in that sooner is also great for your own learning.
Yeah, I resonate that heavily. One of my really great friends said to me that you should learn content with the intention to teach it. And that will completely transform the way you memorize things, because it's not about you thinking about how you can remember it. It's figuring out for yourself, how can I make someone else remember it better? And that shift in mindset completely transformed the way I learned content.
Yeah, so it's great for your learning, and it's nice because I'm sure there'll be countless times already, but also in the future where senior years have helped you out. And like you're already in a position to help the people coming through. And yes, I think the point I'm making is put your hand up, say yes to everything, and I don't think you'll be disappointed.
Now, on that line of putting your hand up for everything and taking opportunities, one of the opportunities that we have at UNSW, but also other medical schools, is having a research component to our degree. And for UNSW, that's a full year. How did you decide what you were going to do in your research year?
So I think I'll talk a little broadly about that. Some people have a very specific specialty or subspecialty or subspecialty in mind, and they've known that for some time, which is, that's fine. Yeah. That's really good actually. But in that case, their research, they chose a supervisor who could give them that exposure. For me personally, didn't really have an idea what I wanted to do. I knew I wanted to do something internally medicine related, not sure with kids or adults at that moment in time. So I just talked to some senior colleagues, and I heard really good things about my supervisors. So Professor Rick Day, Dr. Ayn Ung, and Dr. Matthew Coleshill at the Clinical Pharmacology and Toxicology Department at St. Vincent's Hospital. So I just heard really good things about them as supervisors. I met them. We had a very brief meeting. They showed me their projects, which were data-based, and I knew I really liked my QMP in phase 1. I couldn't really see myself doing the lab work. So we shook on it there. And, I think the official advice is to see as many supervisors as you can and you sleep on it. But no, when you know. So I guess I chose my project because of, how amazing the supervisors were and the type of project. But then subsequently, when I went home and I read up about gout, I thought, wow, this is incredibly fascinating. Yeah. And, gout is an inflammatory arthritis. It's essentially curable. We have effective medication called urate lowering therapy, and yet outcomes for gout are so poor, and so is medication adherence. So our work tried to look at illness perceptions, so how a patient views their gout. Do they see it negatively? Do they see it as something that responds to treatment? Can their personal actions control it? And what we found is that, if you have these optimistic perceptions, you have better health outcomes. Oh, so wow. perhaps there's a role for education and illness perceptions, and then supporting that patient manage their gout with like smartphone apps. So to answer the question, even though I think gout's incredibly exciting area, so much we can do to improve quality of life, I didn't need to know that when choosing the project. It was more just sort of the supervisors and the type of project.
Yeah, so it's almost like there's two pathways you can go when choosing an honors project. And one is for a specific exposure that you're looking for. And the other one, and that's for people that already know what they exactly want to achieve. And the other side is I want to learn the most in general about medicine. And you try to find the supervisors that will be able to provide the best kind of support.
Absolutely. And also just the type of project. You can have like lab-based projects. But, my first year microbiology, I knew I didn't want to pipette all day. I think my good friend Arya, hi Arya, if you're watching, he did all my pipetting for me. And I would do the...
Oh, you're the first assistant in the back. It's like, you can do the pipetting.
No, I'll do the maths, you do the pipetting.
Yeah, I was doing the maths and the calculations. And then my good friend was doing the pipetting. So I knew I didn't want to do lab work, which is fine. Like some people love lab work and it's like incredibly interesting, but that wasn't for me. So I think also the type of project, so data-based. Like I was really interested in SPSS and R and SAS, and I found that very intellectually rewarding.
And what did you do for that full year besides the project? Were there clinical exposures? Was there other opportunities which came up?
Yeah, I think it just comes back to what we talked about before, just saying yes to everything. Because if you just want to go through the motions, I need to do a lit review, I need to do a manuscript and an oral presentation, you could still fly below the radar. So I think it's about, volunteering. So I had the privilege of going to some rheumatology clinics with Prof. Day. We also had Journal Club once a week.
Oh,
and Journal
those are
Club,
really fun, yeah.
Yeah, so normally as students, you often attend, but I, put my hand up to present, and I think I did 5 or 6 presentations that year.
Wow.
Yeah, and it's because it really pushes you out of your comfort zone. I'm sure we've all done lots of med school presentations, but when you're presenting to, clinicians and hospital scientists, and the paper that you're critically analyzing is, completely out of your zone of knowledge. It's very challenging and rewarding, and I learned a lot about, evidence-based medicine and how to, critically analyze evidence. So presenting at journal clubs, and then also discussing with colleagues, like working in the office, popping over to your neighbor, they might be an honors student or a PhD student, asking them, hey, can you tell me about your research? So what are you doing? And you can sort of bounce ideas off each other and help each other out and also learn a lot. So I think there's a lot of learning to be had in an honors project that lies outside your actual project. And I think that's also the great value of having the entire year rather than just doing, I think all MD programs have research, but maybe not all of them will have like a sort of full-time year-long placement in research. I think the convener of honors at the time, Dr. Smith, I think he's in a different role now. He said that your honors year is like a research internship, and I couldn't agree more with it at the end of it.
Yeah, I think from what I hear, it sounds as though you're very open to saying yes to a lot of opportunities, and you're like almost very courageous in taking on activities that are just slightly outside of your comfort zone.
I wouldn't say courageous, but
I think from our perspective, it's a form of courage, and it's almost as if like you feel as though this is going to be challenging for me, and I'm going to attempt it purely almost because it will be a challenge to me, and I feel like I have the opportunity to grow within this opportunity, essentially.
Yeah, so I remember the first paper I did was on artificial intelligence and machine learning, and it was a 12-page review article.
Oh, wow.
And it was just it's just like pure maths. And I was presenting to the author,
fascinating. Yeah.
the author of that paper, who's a world leader. He was on a research fellowship from France, and he was coming for like a month. And this is the first interaction.
Did you know that you were presenting to
No.
Even better.
It was just like in the middle, it was like, oh yeah, by the way, I wrote that.
No, but he really liked it. He gave me some good feedback. So yeah.
So how was that experience? And what I guess the general question is, what makes you like comfortable with that kind of like pressure on yourself?
Like
It's not pressure.
Almost?
I think it's
I guess so.
I think it's just allowing yourself permission to fail, but not even fail. Just realize you don't have to do everything and be perfect at everything. And again, it comes back to being a medical student. You have, well, everyone has permission to fail, but when you're a medical student, you have even more so. You have every right to put your hand up for every learning opportunity. And if you sort of make a tiny mistake on this sort of algorithm in the machine learning, like, so what? You can learn from that. And just having a growth mindset and realizing whatever you do, you're going to learn, you're going to improve.
So how did you find the transition from fourth year research back into the more heavy clinical expectations in fifth year?
I think it's a difficult transition because you have spent some time away. But also on some reflection and talking to peers, I think it would always be a challenge moving from your third year at UNSW, which is still a clinical year, to your fifth year.
Yeah.
Because the expectations do change. So I think what all of us have been alluding to is that in third year at UNSW, you're not always attached to a clinical team. Sometimes you are and sometimes you are, but a lot of the time you have that permission to roam. Fifth year is more for sort of conventional med school clinical experience. So just having those expectations, to be there every day at 7 a.m. for the surgical ward rounds, it is a jump. So with or without research, I think it's always going to be a difficult transition.
Okay.
And I'm not sure the research made it any different, especially because we had that clinical catch up.
Okay. And so when you were back into the clinical realm, I guess, did you have a different perspective on what it would be like then to work, I guess, as a doctor who does both clinical and research work? Or
Yeah, absolutely. Because doctors are always trying to advocate for their patients and look after the patient's best interests. But it's really fascinating how research influences clinical practice.
Yes.
So I think what I've learned is that to do research as a doctor is incredibly fulfilling because it's just an extension of how you can help people and shapes management, not just of your patients, but patients all over the world, which I think is, pretty interesting.
I really like your perspective on research because I think a lot of people are almost a little bit scared to go into research because they're thinking, I really enjoy the clinical aspects of medicine. That's something that I'm really, I guess, that's what I'm there for.
Yeah.
But that's so nice to hear that actually research does have a role in medical practice and actually doing that is a really valuable thing.
Research can be very clinically oriented. So my research was into illness perceptions, and the takeaway from it wasn't some complex molecular structure that we'd discovered. It was essentially very brief. We said, you know what, we should ask our patients what they perceive to be the cause of their gout. And if they say we think it's caused by our drinking and our diet, we just say to them, you know, maybe that's a risk factor, but we think that your genetics in kidney disease have a greater role. And that was it. And we decided that if we can just get that point across to patients, they're probably going to have better adherence and have better outcomes. So I think research can be very clinically connected, which is, you know, it all sort of works together for patient good.
I want to also mention this thing that I've kind of like noticed as well, almost, and a few people have come to me about it. Research in a rural setting tends to be a lot more clinical focused than research in a hospital setting, especially in an urban hospital. And essentially what it boils down to almost is a lot of research in rural settings is so clinically focused because it's just exactly what's happening in the community. And usually the title of the research paper is just, so I've noticed this, ? And that's the paper. And it'll be like, so we think that there might be a possibility that this level of care or this specific option could be useful for these types of patients. And then they go through a review process, and suddenly, as it gets slowly moved up in terms of the research ladder, it suddenly becomes best practice everywhere else. And we had recently had a lecture on best practice.
We did, yeah.
About how the way we actually do things is almost 100% research based. Nobody really knows until we do a research article on it. And the only way we know what we do is common practice is because somebody's done the research and statistically it's proven to be better than, that's the only thing we have backing our like Western view of medicine. It's just the research that has been done historically.
That's very interesting. So I think what you are explaining to our viewers or listeners is how to write a PICO question. do you both know about PICO?
Listen to you, QMP, everyone.
Yeah, so PICO is just, it's an acronym that stands for patient, intervention, comparison or control, and then outcome. And you're just walking through our viewers and how to construct a
this was a didactic teaching process.
Yeah, I guess a lot of us don't think evidence-based medicine is really all too applicable. I feel in first and second year, and it's kind of, statistics, well, that's not what I'm here for. But I think everyone's realising now as we go along and as we hear from lovely final years like yourself, actually it makes a difference, and actually it's worth listening to, because that's in the end what you're using to help your patients with. Yeah, and we don't all need to, you know, go into like heavy research, but there's a big role for audits as well.
Yes.
So I think what you're also describing leans into audits. So it's audits are like sort of mini research projects that answer a very specific question in the context of like a certain clinical ward. It could be a really simple question like, how many people are adhering to our bare below the elbows policy? And it can just be like an observation, and this can sort of guide practice even without, you know, like a full-blown, you know, multi-center RCT. So I think audits are incredibly valuable, and it's something as, you know, medical students and future JMOs is really important if we like care about, you know, patient outcomes. How did you actually sustain research throughout your final clinical years of medical school? Was this challenging, or did you find that it was a little bit different and a bit of a, I guess, not a distraction, but something different? So in your clinical years, you do have a bit of flexibility with how you manage your time. And of course, you're attending every day and ward rounds and clinics, and you're learning a lot. But you go home and you ask yourself, what do you want to do with your time? Are you going to study? Are you going to see friends? Are you going to like, what are you going to do? And you make the time to do the research. So obviously I'm busier with the research than without the research, but it's, you know, incredibly fulfilling and exciting. So I'm, you know, happy to make it happen. But also, again, my supervisors are really, you know, amazing. You know, if you have exams coming up, they probably won't expect, you know, a new manuscript to be, you know, pushed out. But it's just good communication with all the sort of stakeholders.
Yeah, I've heard research is working 18 hours a week, but you can choose whenever those 18 hours are in the day.
Yeah, that's a great summary of my fourth year. Actually, you know, probably more than 18 hours, but you know, it was very flexible. You know, some days you want to work long hours, some days you want to do other things. So I think if we're just for the UNSW listeners, I think fourth year is a very good time to, you know, pursue things outside of medicine as well, because, you know, that work-life balance is so important. And, you know, if you don't have hobbies and interests, I think, you know, unfortunately, you might be at a high risk of burnout. So yeah, I think fourth year is a great time to start, exploring interests outside of medicine if you haven't already.
Yeah. So what did you do for your elective, and how did you decide where and what you wanted to do?
Yeah, sure. So I start off by saying that I think international electives are amazing. Like they can be life-changing. They can expand your understanding of healthcare around the world. But I also think you can read up a lot about that, talk to your senior friends. I'm sure there's lots of other podcasts on that. But so I'm going to provide a bit of a unique perspective on this. And I actually did all my electives domestically. Wow. So I did 4 weeks at St. Vincent's and 4 weeks at St. George. And I made that decision for two main reasons. So firstly, I felt I needed more time on Australian wards to prepare myself to be a safe and competent intern. So I attended really well, in my medicine and surgery terms. I did everything I was supposed to do. But when you're doing sort of a core rotation, you have lots of other priorities. Like you have lots of teaching sessions and they're amazing. Like the doctors who teach are incredible, but it means that you're like leaving a ward round in the middle of it. And by the time you come back, the cannula that you're meant to put in couldn't wait, and a nurse had to do it. It means that the patient that you'd been following up and you really wanted to see what the consultant had to say, you've missed that discussion. And also, of course, you need to upskill like your discharge summaries, your consults, your ward round documentation. And of course, myself with all my friends, we did our best, but you do have to, again, as I said before, be self-directed and manage your learning. And sometimes, is it in your best interest to stay on the wards at 6 p.m. every day? So I felt because I was, managing all those things, I never got this sort of uninterrupted pre-internship preparation. So elective, I wanted to do that. And I think I've done that. So I'm really happy with that. The second one is a lot of people use their elective to travel, which I think is amazing. But it also means that when you're overseas in that elective, you'd sort of be, cutting out early on Thursday or Friday and sort of backpacking continental Europe on the weekend, which is amazing, sounds awesome. But I just know that if I did that, I would want to be on the wards full time and I'd feel like I'm missing out on traveling. And then when I'm traveling, I feel like I'm missing out on ward rounds. And then also it's pretty expensive because like...
Oh yeah, for sure.
Yes.
If I accepted my offer for University of College London, I would need to pay rent for a whole month and then to travel on top of that.
Yeah.
Would be like, so in the end, what I'm saying is I kept my travel separate. I traveled for 4 weeks, had an amazing time, but then did my elective separately. But then like to finish, a lot of my friends went to Nepal and Tanzania, Pacific Islands, and they were exposed to unique health challenges, got lots of hands-on exposure, and they had amazing times. And yeah, I'm sure there's lots written and, vlogged about that. But that was just my perspective, which I kind of wish someone had told me in fifth year, so I didn't feel like I was being such a rebel. But I think each to their own, you'll have an amazing elective if you just sort of reflect and work out where your learning priorities lie at that moment in time.
Yeah, that's a really interesting perspective because I think a lot of people go onto electives into other countries with the express interest of like, oh, this is like a good way to kind of like meld the two together. I wanted to travel, but I just like also need to do elective, and it's almost an excuse of such. I
wouldn't say it's excuse. I just say different things work for different people, and that's so fine. And I know a lot of my friends had absolutely loved it, and to each their own.
Yeah, and like your perspective is really powerful as well because having that dedicated time where you work as like almost like a proper intern.
Exactly. Yeah.
Having that time where you're like, this is what my life would be.
Yeah. Exactly.
In 2 years' time, in 1 year time.
Yeah.
Having that experience is so important, especially when you don't really get that quite as much in normal medical clinical
so like
rotation.
Just for our listeners, on your core placements, you're of course trying your best to do all of that, but sometimes things get in the way.
It
like
can be
you have a stack of paperwork that you need to get signed from different doctors and allied health. So that particular week, your number one priority isn't upskilling. It might be trying to do different tasks. And I thought there was some value in uninterrupted time where you could just choose your own adventure for those 8 weeks.
Yeah, it's like concentrating on the things that you feel like will be necessary.
My weaknesses. So I found that doing that meant that I got so much better at bloods and cannulas because the hospital was empty. There were no other medical students, which meant that
oh wait, that's so true.
Yeah.
When you're on elective, everybody else is gone.
I wasn't fighting any other medical students or cannulas at work.
Oh my god! You're the walking advertisement for this type of style.
So like normally when on your team, you'd be in charge of bloods and cannula if you ask, of course. And then if you go to a different team, normally they'll be like, oh, we already have a medical student, or we already have. But now it's like
you're the universal intern.
Exactly.
Oh wow. Okay.
It's also really.
But then I had my ED term in 6 year after that, so everyone caught up. So maybe it was less net beneficial than I initially thought, but still a really great experience.
But yeah, it's also really powerful to be able to do that dedicated time, and in so saving the bit of money to be able to travel, like dedicate to like traveling and dedicate to
exactly.
like,
Just
that
enjoying
time
yourself.
enjoyment.
Exactly. And you can do both at the same time. Many people did. Many people succeed at that, but I don't think that was me. I'm really happy with my choice.
How do you think that we can make the most out of being in medical school?
I think the way you make the most out of being a medical student is to just reflect a bit and realize this is a privilege to be a medical student. In a couple of years, your number one priority will be patient care. And even though as a medical student you contribute where you can be a bit selfish and think, your number one job is to learn. You're a student. So I think once you have that mindset of where you could sort of choose what you want to do, identify areas of weakness and address those, you will get the most out of it. For example, if you've been in clinic for the entire week and you've been there, a whole day clinics, and you reach a point of you're not learning as much as you could somewhere else in the hospital. You just, briefly bring that up to the medical team. They will understand. They've all been students too. They would 100% get it. They're just so supportive. They always tell us, if you're not learning here, go learn somewhere else, because when you're a doctor, sometimes you won't be able to drop your work to learn. You just got to look after the patients, do the discharge somewhere, just do the paperwork. You can't just go, I'm not learning from this. I'm going to go to a different ward and see some cool pathology there. So I think you get the most out of medical student by realizing that you are still a student and savoring that time.
Oh, wow. That's really interesting. I remember somebody said to me this a while ago, and they were like, all you have to do to make the most out of medical school is realize that as soon as you become a doctor, you don't have nearly as much time to study. And that's all you need to almost make that mindset shift. This is the best time to learn because I don't have the expectations of a full-time job per se.
Yeah, it's not just study, it's not just, not saying just run home from the wards and read books, but learn on the wards.
The studying of actually becoming a soft skills, soft skills expert.
And also talking to patients because, again, as a medical student, you have the time to sit down with a patient for half an hour, an hour, listen to their story, not just take the clinical history, but understand, who they are, where they've come from, what's their motivation, what's their biggest concern. And you'll develop a lot of your soft skills, but you could also end up helping the team in discovering information that they didn't know. But when you're the busy JMO, you might not have an hour to take a good psychosocial history from the patient. So
that's so fair.
Well, thank you so very much for coming on to Bedside Murmurs, Daniel. You've been so insightful and had so many reflections upon how to be a good medical student and how to enhance our skills and really just be, I guess, grateful for the privilege that it is to be a medical student. So thank you so much for coming on. We've really appreciated it.
Thank you so much. It was a real lot of fun. Thank you.
Easy. And see you all next time.